peppers. Peter Piper pecked it. We are talking about cannabidiol, also known as CBD. Marijuana and hemp are two subdivisions of cannabis. Marijuana has a lot of THC and a little bit of CBD, whereas hemp has a lot of CBD and a little bit of THC. Marijuana-based CBD is prescription-based, whereas hemp is legal in most states and widely available. Both are non-psychoactive and non-addictive, but the marijuana CBD is highly regulated, whereas hemp-based CBD is not regulated and lacks quality standards. We'll talk more about that at the end of this video, but first, let's talk about forms that you can buy oral CBD in. Full spectrum, broad spectrum, and isolate. What the heck is it? Full spectrum contains all the phytochemicals naturally found in the plant, including CBD and small amounts of THC, about 0.3%. Then we have broad spectrum CBD, which has all the phytochemicals naturally found in the plant except THC. So that's removed. And then we have isolate, which is the purest form of the compound, which is 99% CBD. CBD is touted to have beneficial effects in anxiety, sleep disorder, arthritis, inflammation. What does the research really say? We're gonna dive into that in just a second, and by just a second, I mean now. Let's start by looking at anxiety. Research studies looked at different types of oral administration routes, meaning some used gummies, some used liquids, some used fat under the tongue, and that's fine. Most of them went for about a month of using CBD, but they all used very different concentrations. Some used as little as 6 milligrams in a day, some 400 milligrams in a day. Some found improvements as little as 10%, while others found a 67% improvement after 30 days. The big thing there is that they all found improvements with anxiety. Though some studies were more significant than others, the takeaway here is that CBD does have beneficial effects on reducing general anxiety. We just don't have guidance yet on how much to use. Let's take a minute to look at psychotic symptoms. CBD is of interest here because it doesn't work like any of the other classical antipsychotic medications being used right now. Clinical control trial looked at using CBD over 30 days for some of the patients and using antipsychotic classical medications in another section of the patients. Both patients had similar antipsychotic symptoms, which is good, but CBD did not have the side effects that are associated with antipsychotics, weight gain and increased prolactin. In that way, thumbs up. Then there were other control trials which were looking at using CBD with antipsychotic medications. Now these research studies have conflicting results, which means we can't come away with any recommendations, but we can say that more research is needed to confirm positive results either when using CBD instead of or in combination with classical medications in these cases. If we're looking at sleep, lots of people swear that CBD is their go-to for a good night's rest, and lots of researchers actually agree it has the potential to improve quality of sleep, also reduce disturbances, and reduce the amount of time from when you lay down to when you actually fall asleep. Unfortunately, the studies look at sleep as a secondary outcome, meaning they're not focusing on sleep, but they don't have enough data there to say whether it's significant or not, statistically significant, which is the measure which tells us whether we can follow this guideline or not. So if it works for you and your sleep regimen, have at it. Nothing says it's bad for you. But as far as what claims we can summarize right now, we can say that limited research, no claims yet. Let's now finally move on to our last topic, boop-a-da-boop, of long-term, also known as chronic, inflammation and pain has long been studied with CBD, mostly because there are so many disease states that fall under the inflammation and pain umbrella. A few of the conditions reviewed in studies included arthritis, cardiovascular disease, neurodegenerative disease, diabetes, cancer, asthma, inflammatory bowel disease, HIV-related pain, just to name a few, because there's more. Currently, medications for these diseases suppress the anti-inflammatory mediators. we're looking at CBD to replace these medications or use these medications less because these medications are often associated with side effects, which CBD does not have. And the research is very positive, finding that there is a positive result with CBD. Some disease states with very severe pains where it does not have a significant effect, such as post-operative pain or cancer that does not respond to opioids or fibromyalgia. There are disease states that do have lots of pain that do respond to CBD. So the best thing I can say here is ask your medical care provider. The conclusion that we have then for pain and inflammation. Some conditions seem to benefit from using CBD for pain and inflammation and some don't. So talk to your medical care provider about your specific situation. You can always leave it up to them. There's no one best dosage recommendation. The basic therapeutic amount that you can use is 150 to 400 milligrams in a day. Now this is going to vary depending on your size, your metabolism, your tolerance, either spaced out or in one chunk of the day. If you're going to do it sublingually with a dropper, you'll just place that under your tongue and hold it there for 30 to 60 seconds. That's all for today. Thank you for watching, and don't forget